As we're getting started, one of the first things that we do always is to tune into our whole system. And when we've just had a loss, it's different. Things are different for us when we've just had a loss than on a normal day. And it's going to be different for a long time. Maybe memories coming up of finding out about someone who's died, or there's all kinds of things that can be losses, although physical death is certainly a big one. And when we first hear about it, or we maybe we're there in the room when it happens, or we it kind of settles in, we really see that it's happened, and that there's something that's going to be different forever going forward. And whether that's something really fresh for us, or if it's something that's a little bit more in the past, we can all feel into that. And just hearing the words, I've just had a sudden loss. Those words about having a loss trigger a response in us, sadness for the other person, as well as our own experience with loss. So let's take a moment to settle in and notice what's happening in the body. Notice what's happening with your breath. And of course, the thoughts in the mind are quite activated when there's been a loss. All kinds of thoughts. There could be wonderful memories of the person, our relationship with the person. Always lots of sadness and tears, often regret. So that's one thing we could acknowledge, that when we're experiencing a sudden loss, or when we're thinking about loss that we've experienced, that it's complex. There's a lot to it. And it really saturates our whole experience, our body, our breath, our mind, the thoughts in the mind. And this is a time when it would be really helpful to give ourselves all kinds of room to experience whatever it is we're experiencing. And in this practice today, that's going to be different for all of us. And there's going to be some common things too. So, one of the things that I would point us to is to experience this in our body. What's going on in our body right now? What does loss feel like in the body? And it's not going to feel like one thing during the whole practice. And when we get to kind of a finely tuned observance, we can see, in fact, that things shift and change and move all the time, even in this overall feeling of loss. There's a lot of movement. Notice your whole body from head to toes. What does it feel like in your body right now? And one of the things that is very common is that we don't always really want to feel because it feels like it might be too much. So if you're a little bit reluctant to go into your body or into the feelings or any of that, you could honor that. Maybe work a little bit more around the edges of something or work with your breath. There's lots of intrusive thoughts. You could put them in frames, you could tap on them. And that for now, during this practice, it's a conducive time to feeling, to let go in a way of our memories of the past, of anything that needs to be done coming up, to give ourselves some time and some space to feel. And we can start with our body. Is your body kind of heavy and sad? Is it tight and kind of resisting? Is your breath steady and smooth, or are you holding your breath? A loss is a trauma. And one of the things that happens so commonly is that we disconnect from ourselves. So notice if that's what's happening for you right now. And if that's what needs to be, that's okay too. Maybe you could focus in on your breath for a while. Let your breath and your attention on your breath stabilize. Let yourself anchor to that. Notice if you have a lot of small, kind of jerky breaths going on, or if your breath could open a little bit more, soften a bit more. A really sad, felt sense in the body usually has a longer, sighing breath often. Or when we're crying, there's a different kind of a breath. But whatever it is that's happening with your breath, see if you could bring your attention into your body and into your breath. As you finish breathing out, notice how soft your stomach becomes. Your stomach kind of loosens and goes back towards the spine. As you get to the end of your inhale, there's more of a expansion in the stomach area. Sometimes we breathe very quietly and shallow. It might feel good to do some deeper breathing. Or this might be the time just to really focus in on the breath and let the body do what it's doing without any instruction from us. And if thoughts are coming into the mind, we could be looking at those as well. Images, memories, words, maybe. See if you can stay grounded in your body and your breath, even if you're looking at images, memories. When we've had a loss, there's a lot of thought that gets stirred up, so the mind might be quite busy. So do what feels right for you. Sometimes the right thing is to really just notice the images, let the memories come. Even as you're staying in touch with your body, with your breath. And if you notice that your mind is going into catastrophic thinking or compulsive thinking, see if you could bring it back. It's a natural function in the mind, but it's not very helpful. If that's happening, see if you could bring your attention back into your body and maybe relax your jaw, your neck and shoulders. Focus on smoothing out your breath. Tune into the heart area. Notice the muscles that cover the rib cage along the front and the sides, the back, between the shoulder blades, up into the neck. And this whole area can be held or kind of tight. And if that's the case, see if you could soften that a bit. Soften the muscles, let your breathing open a bit. Notice the energy in your heart area, the heart center, the emotion. This is an opportunity to be really present with ourselves for a little while. To really stay in touch with our body and breath and with the emotion of the loss. And we could just stay with all of the dimensions of this thought and feeling, sensation, breath. Notice as well the space in which this is all happening. There's the space and time of it. And notice if there's anything that seems to be in the way of really deeply feeling whatever it is that's here. Sometimes the mind will be entertaining thoughts about all kinds of things as kind of a distraction. If that's the case, it might be really helpful to let go of whatever thoughts are here and to focus really strongly on the felt sense of it. Whether it's a recent loss or a long ago loss, whether it's fresh or kind of resolved. We never completely finish feeling about some kind of a loss. Significant losses always we feel something around them. And so really going into the felt sense of that in the heart center. And if memories come, then we can notice those too. And there's always that steadiness of noticing our breath. The steadiness of long practice of staying present with ourselves and coming back again and again, being really grounded in the body, being very present with ourselves as we're experiencing this loss. And notice what it is that's disconnecting and what it is that's connecting. Keep withdrawing your attention from thoughts that are disconnecting or anything else that might be in the way of just feeling. Keep coming back again and again, resting your attention in the heart center. We're going to finish the practice in a minute. Before we do, just notice what you've been feeling and if there's something that you'd like to go into or stay with. Give yourself that opportunity. We can also notice that there's a poignancy to loss and there's a complicated nature to loss often. And the more complicated our relationship was with somebody, the more elements that we bring into the grieving process of a loss. And if it triggers some kind of fear in us, then that will also be here. There can be a lot to work with. And how important it is to give ourselves the time to grieve or to process or to think about it or to feel it or to just relax our body and breathe for a while. So, to give yourself permission to take care of yourself in all different kinds of ways as things come and go. And then when you're ready, open your eyes.